Unhealthy eating habits, a sedentary lifestyle, and obesity are the main causes of diabetes. Recent statistics indicate that Malaysia is among the countries showing one of the fastest increases in diabetes cases globally. If this trend continues, it's estimated that 7 million Malaysians could be living with diabetes by 2050.
I think it's time for us to take this issue seriously. Hi, I'm Dr. Nisana Bila and you're watching My Body, My Life.
At present, Malaysia ranks 5th in the world for its percentage of adults with diabetes. Even though diabetes is not a new health issue, the sharp rise in cases compared to the past is very alarming. This worry intensifies as more children and teenagers are also being diagnosed with diabetes. Recent statistics from the Malaysia Diabetes Index reveal that many Malaysians still have limited knowledge and awareness about diabetes and the harm it can cause. Diabetes is described as a silent crisis because almost half of those affected don't realize their condition until they urgently seek medical advice or undergo a health check.
Diabetes is actually an endocrine disease, basically endocrine related to your pancreatic gland. So what is this pancreas does is secrete the insulin, and the insulin will regulate the sugar, and when the insulin not functioning well, the sugar will go up. So this is where the sugar go up, then it cause all the problem, and this is all diabetes.
Worldwide, WHO or the International Diabetes Federation have repeatedly updating the possible numbers of diabetes patients worldwide.
Back then, diabetes used to be an aging disease where the older you get, the more likely you have diabetes. But nowadays, due to the increasing trend in obesity and overweight and unhealthy lifestyle, we have younger and younger patients now diagnosed with diabetes.
In Malaysia, we suspect that almost 1 in every 5 pregnancies are already having a bit of diabetes there. This type of diabetes sometimes disappears when the woman delivers, but that woman has a threat of future diabetes that's very high.
Our pancreas produces enzymes and hormones that help digest food. One of these hormones is insulin, which is crucial for regulating sugar or glucose levels in the bloodstream.
If the pancreas is unable to produce enough insulin or use it properly, then your blood sugar will go up. That is how diabetes starts. There are several types of diabetes, type 1 and type 2 to be the most common.
To understand diabetes, it's very important for us to understand how glucose, which is actually part of carbohydrate, is actually metabolized in the body.
So you have 2 types. One is actually those kiddies who are born with the pancreas not function. Then it is actually, we call it juvenile or type 1 diabetes.
Destruction of your pancreas by antibodies. So your factory is destroyed, so there is no factory to produce insulin, resulting in diabetes.
Nowadays, actually, due to the so-called pandemic of obesity, you're getting more and more obese people, including young children as well as adolescents. So that's why type 2 diabetes among adolescents and children is getting more and more.
Type 1 diabetes occurs when an autoimmune reaction causes the body's immune system to attack the insulin-producing cells in the pancreas. A damaged pancreas cannot naturally produce insulin, so those with type 1 diabetes must rely on synthetic insulin. This condition is also known as juvenile onset diabetes, as it commonly appears in childhood. Type 2 diabetes is the most widespread form globally, making up about 95% of adult diabetes cases. Hence, it's sometimes called adult onset diabetes. In type 2 diabetes, the pancreas still produces insulin, but either not in sufficient amounts or the body cannot utilize it effectively. In the past, type 2 diabetes was rarely observed in children and teenagers, but it has become more common today, particularly among those who are obese.
Diabetes doesn't happen straight away, that there might be a condition that precedes it, or there is a condition that precedes it called pre-diabetes.
The pre-diabetes, basically it means that the sugar start to increase, but unfortunately or fortunately have not fall into the range of diabetes. The impact of pre-diabetes can be reversed back to non-diabetes.
Gestational diabetes, or in the pregnancy where a mother is normal, but during pregnancy, because of the abnormal hormones produced during pregnancy by the placenta, they have high sugar levels.
Pre-diabetes is a condition where blood sugar levels are higher than normal, but not sufficiently high to be classified as type 2 diabetes. Without intervention, however, pre-diabetes can develop into type 2 diabetes over time. Gestational diabetes is a type of diabetes that appears during pregnancy and typically resolves after childbirth. It can pose health risks to both the mother and baby during pregnancy as well as after delivery.
I noticed I had my diabetes 10 years ago, which I went for the doctor for a blood test. You know, every year we go blood test. Finally, suddenly said, my doctor said that, oh, you better be careful. I said, why? You know, your diabetes, your level is quite a little bit high. So I really control until 5 years ago, cannot really.
Diabetes is called a silent crisis because this chronic condition frequently goes undetected. Some individuals, especially those with pre-diabetes, type 2 diabetes, or gestational diabetes, show no signs of the disease, particularly in its early stages. This makes regular health checkups essential, ideally every 6 months.
It all depends on what kind of test is to be done. It all depends on how severe is the diabetes. We can easily just pop the finger to a capillary blood sugar. The capillary blood sugar randomly, the diagnosis of diabetes can be established.
If you're using HbA1c, if your HbA1c results is less than 5.6, then you may not have diabetes. You're normal. But if your result is between 5.7 to 6.2, then you have pre-diabetes. But if it's 6.3 and above, then you have diabetes.
Another way, which we don't do often, but we do it for women with gestational diabetes, we do what we call an oral glucose tolerance test. So we give glucose in the form of, sometimes it's glucose powder mixed with water, or sometimes there's ready-made, glucose drinks. So the lady comes in, or the person comes in after an overnight fast. We take a blood, measure that fasting level, give the drink of glucose, then wait after 1 hour and another hour, and actually measure the glucose.
HbA1c is one of the most commonly used tests to detect type 1 and type 2 diabetes. This test reflects the average blood sugar level over 2 to 3 months, classified as follows. Below 5.6% is normal. 5.6% to 6.2% indicates pre-diabetes. 6.3% or higher signifies diabetes. Fasting blood glucose is measured after an 8 to 12-hour fast, with readings interpreted as below 5.6 millimoles per liter is normal. 5.6 to 6.9 millimoles per liter points to pre-diabetes. 7 millimoles per liter or more indicates diabetes. The oral glucose tolerance test measures blood sugar levels before and after consuming a glucose solution. Below 7.8 millimoles per liter is normal. 7.8 to 11 millimoles per liter suggests pre-diabetes. 11.1 millimoles or above indicates diabetes.
Diabetes symptoms depends on how high the blood sugar level is. What are the common signs of diabetes? We have frequent urination, excessive thirst, and also lethargic or feeling really tired. Noticing the symptoms can help you yourself, your loved ones, before it gets worse.
Women can tend to get what they call vaginal infection. They get fungus, so they get whitish discharge, very itchy in the private area. Men as well can get this, itchiness in the private area because the urine is actually full of glucose. And if hygiene is not kept very well, you can end up getting infections in the genital area as the first sign of diabetes.
As your sugar becomes higher, you may experience symptoms such as you feel thirsty frequently, you may have increased urination, especially at night, you may lose weight because your body will break down fat and protein. But sometimes if your your diabetes is too long, it may damage your eyes and you may have blurry vision as well.
A lot of skin infection, that's number one. And then number two, they start to recognize even a minor cut or wound is a bit difficult to heal. So these are so-called small hint that will actually highlight that we may have to get our blood sugar properly checked.
Common diabetes symptoms worth monitoring include frequent urination and excessive thirst. High blood sugar causes frequent urination, leading to significant fluid loss. This fluid loss triggers persistent thirst. Fatigue and increased hunger. Insulin is essential for converting sugar into energy. When the pancreas fails to produce enough insulin, sugar doesn't convert into energy, making the body tire easily. This lack of energy also leads to frequent hunger. Blurred vision. Elevated blood sugar can narrow blood vessels, potentially harming organs such as the eyes. Poorly controlled diabetes raises the risk of blindness. Slow healing wounds. High blood sugar compromises the immune system. Constricted arteries limit blood flow and delay the supply of oxygen and nutrients to wounds. As a result, wounds heal slowly and are vulnerable to infections, especially when diabetes isn't well managed. Frequent numbness. Consistent numbness in the hands and feet can be an early sign of diabetes. This often arises from reduced blood flow due to artery damage. Sometimes, numbness is accompanied by swelling or tingling sensations.
Sometimes type 1 diabetes, because their symptoms are very dramatic, they will lose kilos of weight in a short period of time. Type 2 not so much, because they tend to be overweight, obese, and the glucose is slowly rising.
Gestational diabetes is worrying because during pregnancy, if the sugar is very high, the mother and the baby itself may experience complications. The mother may have higher risk of developing complications of diabetes, such as urinary tract infections and others. And the baby may become very big, and it causes difficulty in delivering the baby, where the baby may get stuck in the birth canal and get shoulder injury. In the long run, we have noticed that after the mother, even though they have delivered a baby and the diabetes has recovered, there is still an increased 40% chance of them developing type 2 diabetes in the future.
Mine is considered as a type 2. The symptoms I get is very thirsty, and also I always go for urination quite a lot. Even I drink little water, also quite a lot of urination. And then doctor have to prescribe me, okay, you better take medication.
Excess weight and obesity are key risk factors for pre-diabetes, type 2 diabetes, and gestational diabetes. Some diabetes risk factors can be managed through lifestyle changes, including a healthy diet and regular physical activity.
Staying active and even eating healthy can help you lower the risk. However, factors like age, family history is out of our hand. So this time, it's all about what we can control.
Obesity is one of the key things nowadays when we talk about type 2 diabetes. So it produces a lot of funny kind of hormone, fat hormones, which will actually antagonize or actually fight against insulin, causing the insulin become less effective.
There is a higher association with autoimmune disease. So if you have other diseases that affects your antibodies like a thyroid disease or others, then your risk of getting type 1 diabetes is much more higher.
Women with PCOS, they tend to get high risk of pre-diabetes as well as diabetes. And they also suffer from a bit of high male hormone as well as problems to conceive or infertility.
Type 2 diabetes is the most prevalent form of diabetes, both in Malaysia and around the globe. Risk factors for type 2 diabetes include obesity or excess weight. Accumulated body fat can cause cells to become resistant to insulin. Inactive lifestyle. The less physically active you are, the higher your risk of diabetes. Regular exercise helps control weight, uses blood sugar for energy, and promotes greater insulin sensitivity in the body cells. Increasing age. The risk of type 2 diabetes rises with age, especially after 45. Pre-diabetes. If left unchecked, pre-diabetes often progresses to type 2 diabetes. Family history. Individuals with close relatives who have type 2 diabetes are more likely to develop it themselves. Polycystic ovary syndrome, PCOS. Characteristics such as irregular menstrual cycles, excessive hair growth, and obesity can raise the risk of diabetes.
Diabetes can cause short and long-term health concerns, mainly because of the blood vessel damage and from mental health struggles. And yes, in fact, people with diabetes have 2 to 3 times more higher risk developing depression. Diabetes is not just high blood pressure, it is also your overall well-being.
Those who having diabetes mellitus, they have high risk to develop depression and anxiety, because it's something that we call diabetic distress. Once you diagnose with diabetes mellitus, there will be anticipation that you have to monitor your sugar level. So to be very cautious on what you eat, what you cannot eat, and then also the idea to the need to take medication regularly, and some people, they need to take insulin. So it's not easy for many people.
High blood sugar levels over a long period can damage body tissues and organs. Among the long-term complications of diabetes are cardiovascular issues such as coronary artery disease, heart attack, stroke, and atherosclerosis. Other potential complications include neuropathy, nerve damage, nephropathy, which can lead to kidney failure, retinopathy, retinal damage that may result in blindness, lower limb amputations, gastroparesis, a digestive disorder causing prolonged stomach emptying, sexual dysfunction in both men and women, skin infections, hearing loss and oral health problems. Diabetes can also contribute to mental health disorders, notably depression.
If your sugar is very high or your diabetes is very severe, then you may need insulin treatment. If the risk is unavoidable, for instance, you have a strong family history, then you're encouraged to check your blood sugar frequently.
In terms of medication, we would like to go more aggressive nowadays to bring the sugar down as quick as possible. Then we will actually, from there, we'll actually cut down the medication.
We've now recently, there's a lot of interest in lifestyle programs, improve your food intake, physical activity. As a result of that, you can lose weight, get your stress down, and then glucose gets better.
The most common therapy that we can offer is cognitive behavioral therapy. So we work again to reframe the negative thinking. Other than that, having support group can ensure compliance to diabetes care and also reinforce healthier coping skill in these individuals. So in this case, for certain situation, family therapy to encourage individual with diabetes mellitus and mental health disorder to practice healthy lifestyle and healthy coping skill.
We need to educate the patient about carbohydrate counting. The most important thing is that patients have to know about the types of carbohydrates and the amount of carbohydrates that they can take. Sugar is also considered as carbohydrate as well, because no matter what type of carbohydrates, in the end of the day, after it digests, it is sweet. So no matter how what type of carbohydrates, we have to be careful.
Diabetes, exercise is very important, crucial for them to do. Just doing physical activity, walking is good enough. Also, doing some weight training, recreational sports. Recreational sports is when you meet friends, you get to do activity together. So when you increase your activity levels, you start burning energy and your body demands less stress. So insulin becomes a bit more sensitive. You're able to reduce your metabolic syndrome and you will start to feel a lot better. But it is not just the exercise alone, it is a combination of exercise, diet and well-managed medical condition which you do with your doctor.
Healthy lifestyle changes can help not only control pre-diabetes and type 2 diabetes, but also prevent them. Adopt a low-fat, low-calorie diet that is rich in fiber from fruits and vegetables. Stay active or exercise more frequently and work toward losing any excess weight. The recommended treatment and management of diabetes depend on the type of diabetes and its underlying causes. Type 1 diabetes cannot be prevented, so patients need synthetic insulin to replace the natural insulin their body cannot produce. If lifestyle changes alone don't adequately lower blood sugar for type 2 diabetes, synthetic insulin and other medications may also be recommended. Regular monitoring of blood sugar levels is essential to determine how effectively a treatment plan is working.
Diabetes can affect anyone, regardless the age, and it can last for a lifetime. That is why it is important for us to create awareness and promote healthy lifestyle. Not just for yourself, but for your loved ones. A healthy body nurtures a healthy mind. I'm Dr. Nisa Nabila and thank you for watching My Body, My Life.